Sorry. Hello, my name is Stephen Baker. These are my comments to be presented on November 15th, 2011, 2:30 p.m. Senate Health, Education, Labor, and Pensions Full Committee on Medical Devices, Protecting Patients, and Promoting Innovation. Have any of you heard of the 1950 radio TV show Truth or Consequences? The medical device industry lobby is playing the game no truth, no consequences with the Congress. Congress is enabling this industry to fleece the taxpayer of essential and limited health care funds and endanger patients and their families for profit. You must change the federal public policy. On October 5th, 10 years ago, I was a valued 23-year Union millwright, proud Air Force veteran, and father of 2 middle school children living on Cardiff Lane, less than a mile from Republican Congressman Eric Paulson's Minnesota 3rd District office. That day I was offloading a client's catalog printing press to be compressed to a scrapyard when another worker's mistake pushed me, forcing me to fall 4 feet down into the scrap. My right arm was badly mangled. 7 surgeries and 8 years later, it was clear that I could not return to work that I loved, and reluctantly began receiving my SSDI for my permanent injury. My surgeon recommended that I consult the Mayo Clinic because there was a new innovative elbow joint replacement option that would reduce pain and increase function. The Tonier lateral elbow prosthesis was surgically implanted in my right arm on May 19, 2008. It was paid for by my private insurance covering my work injury. The healing process went well for several weeks, but then I noticed during movement it would make a popping or creaking sound. Early in September 2008, in a phone conversation, I told my sister that the elbow was blue-green and I was in extreme pain. She was so concerned she took it upon herself to fax the Mayo Clinic. On September 29, 2008, the prosthesis was surgically revised, just 4 months after the original implant. The surgeon designer told me that he would reattach the radial stem to the head, but both components were removed and confiscated for 1 year. I asked the doctor to report the adverse event to the FDA MedWatch. He refused. On November 18, 2008, number 500-9052 was assigned to my self-report. Freedom of Information, FOI, reported March 4, 2009 that the file could not be located. There was no investigation. I am now in medical and legal purgatory. The private insurance company is bulking and paying for another surgery. I am in extreme and constant pain. The elbow does not function. My teeth are falling out because I have been prescribed long-term maximum dose hydrocodone pain medication, which dries my mouth, producing cavities that weaken my teeth so much but they disintegrate and disappear as I sleep. Tonier declines in helping to devise a custom device solution. The Mayo Clinic sent me a letter stating that no care other than federally mandated emergency care would be provided. I have done all the normal things an enlightened and empowered patient could do. I tried to communicate first with my doctor, the Hospital Patient Affairs Office, the trustees of the Mayo Clinic, my U.S. Congressman Eric Paulson, the U.S. Senators Al Franken and Amy Klobuchar, and the FDA. All this I've done while disabled, medically impoverished, and in pain. Too late I learned that the medical devices are not properly regulated. Implanted medical devices should be given the most rigorous scrutiny, yet they are cleared through the 510K process that on July 29, 2011, the IOM Institute of Medicine reported should be scrapped. There is no clinical testing prior to clearance and no national independent robust post-market registry to show that the innovations are of any improvement over no surgical implant device or the ones that are currently available. My Mayo Clinic surgeon was the designer of the device, and he also paid to train other doctors by that device company, contrary to the Mayo stated policy of having only salaried physicians on staff. Joint replacements are now the #1 expenditure of Medicare. The life cycle of the medical devices from inception to FDA clearance to market to surgical implant excludes the patient stakeholder. Patients and their advocates should be full voting partners in this endeavor. Marketing, politics, and lobbying currently drive the decisions by practitioners, purveyors, and payers in selecting what they anticipate to be life-enhancing implanted medical devices. Experience, data, and science are evaded. On May 28, 2009, I had an appointment with Representative Paulson. He and his staff offered me no constituent services, and the meeting was brief. The revelation that he is spearheading the effort to eliminate the medical device industry, medical device user fees, clarifies his cavalier attitude about the failed implanted medical device that was brought to me to his office. My elbow was produced by Tonier, a company with its world headquarters just 6 short miles from his office. Because of my disability, I must leave my family and my lifelong home in Minnesota each winter to avoid the painful cold and dangerous icy conditions. Valuable jobs in the medical device industry will be secured only by a regulatory system that truly rewards safe and effective innovation. I'm a big fan of innovation and proved it twice by trusting Tonier, the surgeon designer, and the Mayo Clinic with my life. My advice to this committee: halt this dangerous game. No truth, no consequences. Properly regulate this industry. Thank you.